You must be questioning yourself how NSAIDs act on cyclooxygenase enzyme. The cyclooxygenase enzyme system is the major pathway catalyzing the conversion of arachidonic acid into prostaglandins. Cyclooxygenase exists in two isoforms, referred to as COX-1 and COX-2. Even though the two enzymes are similar in size and structure, COX-1 and COX-2 are regulated by different systems and have different functional roles. The main difference between them is that COX-1 is a housekeeping enzyme located in most notable tissues, like platelets and endothelial cells, while COX-2 is rather on the site of inflammation, for example, fibroblast and monocyte. Now, cyclooxygenase is the rate-limiting enzyme that is responsible for the first two steps in the synthesis of prostaglandins. Prostaglandins are derived from enzymatic metabolism of free arachidonic acid to prostaglandin G2 first, and subsequently to prostaglandin H2, followed by the production of the bioactive prostaglandins, prostaglandin E2, prostaglandin I2, prostaglandin D2, prostaglandin F2 alpha, and thromboxane A2 by tissue-specific synthases. During normal physiological conditions, prostaglandins play an essential role in the regulation of renal hemodynamic, renin release, as well as water and salt balance. Likewise, prostaglandin synthesis can be stimulated in response to distinct pathophysiological situations, including inflammation, pain, and cancer. Well, COX-1 and COX-2 enzymes possess a long channel that is wider in the COX-2 enzyme than COX-1. If we talk about the non-selective NSAIDs, they enter the channels in both enzymes and block them by binding with hydrogen bonds to an arginine halfway down. This reversibly inhibits the enzymes by preventing the access of arachidonic acid to the catalytic site, and hence, resulting prostaglandins are not synthesized. Well, this is not applied to aspirin, because aspirin is unique in that it acetylizes the enzymes at serine 530 rather than arginine and is therefore irreversible. Now, how some of them are just COX-2 selective, while others being not selective? Wait. I can help you with that. Selective COX-2 inhibitors are generally more bulky molecules and can enter and block the channel in COX-2, but not the narrower channel of COX-1. So, they are specifically COX-2 selective. If you want to learn about them in details, then do check out our lecture on aspirin mechanism of action. So, now that you know that NSAID works as analgesics, anti-inflammatory, and antipyretic, you must be questioning yourself how. So, let's discuss. How will NSAIDs help us in fever, pain, and inflammation? Let's discuss them one by one. Firstly, if we talk about the analgesic action of NSAIDs, or pain-killing effect, we can say it is exerted both peripherally and centrally, but the peripheral actions predominates. PGE2 is thought to sensitize nerve endings to the action of bradykinin, histamine, and other chemical mediators released locally by the inflammatory process. Thus, by decreasing PGE2 synthesis, the sensation of pain can be decreased. As COX-2 is expressed during times of inflammation and injury, it is thought that inhibition of this enzyme is responsible for the analgesic activity of NSAIDs. NSAIDs are used mainly for the management of mild to moderate pain arising from musculoskeletal disorders. One exception is ketorolac, which can be used for more severe pain, but for only a short duration. Now, secondly, we have antipyretic effect of NSAIDs. Well, this is the mechanism of fever. We know that fever occurs when the set point of the anterior hypothalamic thermoregulatory center is elevated. Endogenous fever-producing agents, Pyrogens, such as cytokines, are released from white blood cells, are activated by infection, hypersensitivity, malignancy, or inflammation. This stimulates PGE2 synthesis. It increases the temperature set point in hypothalamus, increases heat production, and decreases heat loss. Now, what NSAIDs do is that they lower body temperature in patients with fever by impeding prostaglandin E2 synthesis and release. These agents essentially reset the thermostat toward normal. This rapidly lowers the body temperature of febrile patients by increasing heat dissipation as a result of peripheral vasodilation and sweating. But so remember that NSAIDs have no effect on normal body temperature. Thirdly, NSAIDs have an anti-inflammatory action. Now, what happens in inflammation is that prostaglandins produce vasodilatation and increase the vascular permeability. However, inhibition of prostaglandin synthesis by NSAIDs attenuates rather than abolishes inflammation because the drugs do not inhibit other mediators of inflammation. Nevertheless, the relatively modest anti-inflammatory actions of the NSAIDs give some relief from pain, stiffness, and swelling to most patients with rheumatoid arthritis, but they do not alter the course of the disease. So that was about mechanism of action of NSAIDs. I hope you are pretty much clear about how NSAIDs work in your body.